So we've taken the splint and everything off, cleaned up the patient a little bit. You can see these beautiful there. Right afterwards, you can see she has a beautiful configuration. Has a lot of swelling in the ascending processes of the maxilla, which is this area right over here, or the lateral wall of the nose. And the tip is a bit swollen also, but not that bad. So we tell the people how to clean their nose after the splint is removed. So this is the last paragraph of my instruction sheet. So you look in there and it says start spraying your nose with nasal saline every hour to every other hour during the wake hours. And then after 1 week, then you do it about 2 or 3 times a day. Okay. It also says in that instruction sheet to clean your nose twice a day. The way you clean it is you get some peroxide and water, half and half, and a Q-tip, and you clean the base of your nose. This is where the incision is located, right there. Mm-hmm. Okay, right in here, right there. And then you clean the inside of the nostrils just to the head of the Q-tip, just like that. And you're going to see some brown sutures falling out, and they're supposed to fall out over the next week or so. So you just do this cleaning for 1 week. Do not do the peroxide cleaning beyond 1 week, because peroxide, if you use it for weeks and weeks and weeks, is actually injurious to the tissue. So you don't want to use it for a long time. Okay? After you do the peroxide and the water cleaning, then you take some bacitracin ointment. This is sold over the counter. And you put it in the same areas that I just cleaned. You put it in the base of your nose where the incision is, and then you put it in the nostrils right over here, and you put it in the nostril right over here. So you don't have to go digging deep in your nose, just to the front, and that's where the marginal incisions are located, right in here, right in here. And some people, over the course of the next 1 month or so, those incisions will thicken. So you'll feel a little ridge there and say, oh my God, what the hell is this? And those ridges or incisions will slowly dissipate, but it can take a year before they dissipate completely. So don't get scared about it. And you will be seeing me over the next 1 to 2 months. And if I find that they're excessive, I will inject them with steroids and things like that to try to get them to be less prominent. Okay? And again, this bruising right here underneath the eye, right here and here is normal. And you can use that arnica cream that we gave you continuously. And I would probably use the arnica pellets still for another week. Those are the ones that dissolve underneath your tongue. Okay? Any questions so far?
No.
Okay. Video off.